Arirang TV's special coverage of COVID-19. On March 26th, leaders of the G20 countries held talks in hopes of coordinating a global response to the pandemic. An interesting aspect of the summit this time around was that it was virtual. Indeed, the pandemic has led to dramatic changes in society, and in today's episode, we touch upon the changes in community in light of the contagion. But first, we have our Khun Soa and Noaram in the studio with the latest news on the coronavirus. Welcome.
Thanks. Good afternoon.
Now, Soa, you've been covering the situation in and outside of the country this past week, this week. What is the latest you have?
Well, here in Korea, if we start off with the domestic news, there has been no dramatic change in the numbers throughout the week, which we could say it could be a good sign. But when compared to the surging figures abroad, that is. But with more people coming actually from other countries to Korea, we should keep our guards up, especially this weekend. With a weekend ahead of us, we must remain cautious. And that is also why authorities stress social distancing is extremely important this weekend. Yoon Tae-ho, a senior health official, said at the latest government briefing on the virus, people should refrain from going outside and travel in their personal vehicles instead of using public transportation. Now, Prime Minister Chung Se-kyun at an earlier meeting mentioned the number of new cases in Korea seems to have relatively stabilized, but the proportion of imported cases is going up. However, as 90% of patients connected to infections from abroad are actually South Korean nationals, he waved off the chance of an immediate entrance ban, which some people are actually calling for due to the rise in cases abroad.
I see. Tell us a bit about the actual numbers for today then.
Well, we had actually less cases from abroad because we had some more than 50 cases that were imported, but we are seeing 19 cases from abroad today, with 13 of those detected due to the strong measures at the airport. But still, if we take a look at our table here, we do have 91 new cases, bringing the total number to 9,332, and 8 more people have died of the virus. The death toll stands at 139. Meanwhile, the number of people still in quarantine and the ones that have fully recovered stand similar in their 4,000s. Now, let's see where these new cases have occurred. Now, we have a rise in Daegu by 34 and Gyeongsang-Buk-do province 9 and 12 new cases in the capital Seoul. But more numbers are likely to be added to this tally tomorrow, as a new cluster of infections recently was reported at a hospital in Daegu, and more are actually waiting for their results. And currently we have 52 patients at this specific hospital, so we will probably see a pretty rise tomorrow.
I see. Now, while the numbers here in Korea are relatively stable, I understand this is not the case in the US.
Right. So for the first time, in fact, since the novel virus broke out in China, a different country has surpassed the number of total confirmed cases, and that is, as you said, the U.S. More than 83,000 cases have been reported there, with that becoming the new epicenter of the virus. And that's a little more than 2 months after the U.S. reported its first case. Now, all 50 states are affected, and on Thursday local time, at least 24 states reported more than 100 new cases, and the worst hit region remains to be New York, with more than 6,400 new cases. So let's take a closer look at the figures of major international outbreaks. There was no big change in the order of confirmed cases throughout the week, but now the U.S. is on top of the list, followed by China and Italy. To the surprise of some people, maybe it's not Italy, but the U.S. actually that surpassed China at a faster speed. Meanwhile, China has 55 new cases now, and it is really now focusing its preventive measures on curbing the spread and preventing a return of the spread, because now it is in concern that imported cases may lead to a similar case as they had before. So they are actually banning foreigners from moving into the country beginning on Saturday. Yes, and meanwhile, as more and more countries are affected by the virus, South Korea has become a model for others in handling of the crisis and has offered its support to other countries that are really hard hit by the disease.
Right, and that was precisely the pledge made by President Moon Jae-in during the G20 summit yesterday, right, Aram? Tell us more.
Yeah, so in a joint statement after that virtual G20 leaders summit, they said in a joint statement that it is their absolute priority to tackle the virus's health, social and economic impacts. They presented a united front against the coronavirus pandemic. They added they were committed to restoring confidence, preserving financial stability and reviving growth. The G20 leaders said they were committed to resolving disruptions to global supply chains, which have been severely affected by the outbreak. They also asked finance ministers and central bank governors to coordinate regularly together and with international organizations to develop an action plan, in their words, in response to the pandemic. They also pledged a $5 trillion fund into the global economy, so a joint effort there. And they also vowed to work with multilateral bodies such as the IMF and the WHO, as well as regional banks as well, to deploy what they called a robust financial package to support developing nations. And President Moon Jae-in, meanwhile, said Korea's response model features 3 principles of openness, transparency and democracy. He says South Korea is willing to share its what he called successful response model with the international community. And of course, Korea has been under the spotlight and has been praised by the global media and experts alike about the countermeasures it's taken against the outbreak. President Moon said the outbreak is gradually stabilizing in Korea, but did note that the country is not out of the woods just yet, so we cannot be complacent. He urged for joint efforts to develop treatments as well as vaccines. He also proposed that member countries share quarantine experiences and clinical data, as well as allow travel of essential personnel. So these would be scientists, doctors, as well as business people as well, because Moon stressed the importance of maintaining essential economic cross-border exchanges.
Right. Given concerns over rising importer cases, the government is set to step up its quarantine measures against for those arriving from overseas. Yep. And the US is now going to be included in the list to be subject to those quarantine measures.
That's right. And as Sarah mentioned earlier, the US is now the new epicenter of the coronavirus. It has got the most cases around the world, and therefore the Korean government is taking action against passengers arriving from the US, Korean citizens or foreign nationals alike. They will be quarantined for 2 weeks. That measure has started today. The measures were prompted by the surge of cases in America. Similar measures have also been taken for arrivals from Europe as well that we've seen. And violators of these self-quarantine measures will face tough punishment, the government says. These will include fines, as well as deportation for foreign nationals and even jail terms for up to a year. So they are really doubling down on these quarantine measures. And also to make the testing process at Incheon International Airport, the gateway to Korea, there's the so-called walk-through testing facilities that have been set up, which are capable of testing 12 people an hour. And there has been some backlash at International Airport because the process wasn't as efficient as hoped, because they had a larger number of people coming in from abroad than expected. So they have set up these walk-through. We've seen drive-through facilities, but now we've seen these walk-through facilities at the airport.
I see. Aram, let's take our attention to North Korea, which has yet to acknowledge a single case of the virus, of course. Hundreds of people had been under quarantine there, but some of them have been released, I understand.
Yeah, so just to give you the numbers, just under 2,300 North Koreans and 2 foreigners remain under quarantine in North Korea. That's according to the North State media, the KCNA, which said 1 additional foreigner was released. Now, the KCNA earlier had said that all but 3 foreigners were released out of the reported 380 foreigners under quarantine. So out of those 3 foreigners left, 1 has been released, so 2 remain. Although Pyongyang has publicly denied that it has any case of COVID-19, many experts are skeptical of that claim because it has a very porous border with China as well, and there's many factors that come into doubt those claims. And news reports have also come out recently claiming the regime is secretly asking for coronavirus aid from other countries.
I see. Yeah. Well, we'll probably hear more about that later on. Well, that is the update on the coronavirus from here and around the world. Thank you, Aram. Thank you, Soa. We'll probably see you again next week.
Next week. Thank you.
Right now, we are poised to listen in on the latest briefing on the COVID-19 situation in Korea. The Central Disaster and Safety Countermeasure Headquarters will walk through the latest tallies as of early Friday. Now, as our Kon Soa mentioned, the numbers worldwide, including that of the US, are on the surge, reminding us yet again about the frightening frightening spread of the contagion. Korea saw 91 cases today, raising the total to 9,332 as of early Friday. We will get back to you after this briefing.
Here is Jung Eun-kyung, the director of the KCC. Let us now begin our regular briefing for the coronavirus outbreak. On the March 27th, Friday, as of today, the total number of confirmed cases stands at 9,332. This includes 309 imported cases, which of them, 31 of them were foreigners. And of them, 4,928 have been discharged following full recovery. And we have seen 91 new cases yesterday, and we are seeing a steady decrease in the number of those who are being discharged. And the enumeration investigations show that 81.1% were related to cluster infection, and 14.4% were under investigation or sporadic cases. And as for the infection routes, 309 of the total cases were related to imported cases, which accounts for 3.3% of the total. And related to Shincheonji, there were about 7,600 cases related to the cluster infection, and about 571 were related to Shincheonji. And cluster infection related to hospitals and nursing hospitals were about 15%. And those cases related to the contacts of the confirmed cases were 11%. And by regional breakdown, Seoul City saw 12 more new cases yesterday, and most of them were imported cases or those who have been come into contact. And in Daegu, there were 34 new cases, most of which were from nursing hospitals as well as other cluster infections. And next, Gyeonggi-do province had 11 cases. Most of them were imported cases from abroad. And also there was related to the Bucheon Saengmyeongsu Church, where we saw an increase of the confirmed cases from the contacts. And in Gyeongbuk region, we have the 9 more cases, as we saw a surge in the contracted cases from the nursing hospitals. And from the airport quarantine, 13 new cases have been reported. And as for Seoul City, 3 more confirmed cases were reported from the Gurogu call center. And about 163 confirmed cases have now been confirmed at this the call center. And also in Daegu, there was also related to an inpatient, and we confirmed a new case of the infections, and we conducted and screened all of the 355 patients, and right now we confirmed 62 patients confirmed. 61 of them were inpatients and 1 was the professional caregiver. And this was on the same building of the Daesil Nursing Hospital, where we witnessed a cluster infection. And as of March 21st, we conducted the screening tests on every one of them, and most of them were conducted negative. However, one person was later found to be positive. Therefore, we conducted additional rounds of testings, and therefore we also are carrying out enumeration investigations for all of the people who are going in and out of this building. In light of the recent rise in the percentage of imported cases, we will be intensifying our screening at port entry and strict self-quarantine monitoring, because this is very important. As of the 91 cases yesterday, 19 of them were imported cases, accounting for 20% of the total from yesterday. From Europe, there were 11 new cases, 7 from US, and 1 from China and Asia, and the rest were and the 13 were foreigners. And we also witnessed 13
정부는
cases at the
3월
airport,
22일부터 유럽발
while the rest were
입국자에
the
대해서는
community
자가
spread
격리와
of the
전수 진단 검사를
virus.
실시하고 있습니다.
And the government has
금일
intensified
0시부터는 미국발 입국자에
all of
대해서도
the screening
자가격리
for
조치와
the screening processes
유증상자에
for
대한
for all of the
검사를
inbound
실시할
travelers from Europe
미국발
and
입국자
US.
중
As of
유증상자는
midnight
내외국인
of
관계없이
27th, we
공항 검역소
implemented
시설에서
an inbound
대기하면서
traveling,
진단
the
검사를
inbound
실시하게 됩니다.
screening process for
검사
all of
결과가
the people
양성으로
from
확인된
US.
경우에는 병원
And
또는
all
생활치료센터를
symptomatic persons
이송하여
entering from the US
치료받게
and
되고 음성으로
the
확인된
US will
경우는
be required
14일간
to have
자가격리로 관리하게
have
됩니다.
testing at the airport.
입국 시
And
증상이
they will
없는
be
내국인 및
also,
장기체류
if they are
외국인은
tested positive, they will be
14일간
transferred to an
자가격리에
hospital or a
증상
life treatment
발생
center.
시
And for
코로나19
Korean
진단
nationals and
검사를
foreigners
실시하게
with a
됩니다.
domestic residence, they will be staying
앞으로
at home
미국의
for 14
코로나19
days.
확산 상황과
And we will
미국발
monitor
국내
closely
입국자 중에
the
확진자의
outbreak that is happening in the US.
필요한 경우
And if needed,
진단
we
검사의
will
범위를 확대할
also
계획입니다.
decide on
장기
expanding
방문 외국인에
the
대해서는
scope
임시
and
검사
target
시설에서
of the
진단
screening.
검사를 실시하여
And for foreigners who
음성일
are on a
경우는
short-term
자가관리
visit
앱과
without
강화된
domestic
능동
residence,
감시로 관리하겠습니다.
we will be testing
해외
them at
입국자 중
temporary
자가격리
facilities.
대상자는
And if they are tested
자가격리자의
negative, they will be allowed
안전보호 앱,
entry under enhanced
행안부가
active
관리하고
monitoring.
있는 안전보호
And
앱을
for all
입국
inbound
단계에서부터
travelers,
의무적으로
all
설치하여
of them will be mandated to
발열들
download
의심
the
증상을
self-quarantine
매일매일
mobile
확인하고
application.
위치
They
정보를
will be
확인해서
required to
생활
check their
수칙
body
준수
temperature on a
여부를
daily
점검하는 등
basis.
관리를
And
강화합니다.
we will be intensifying our management and control on these
중앙방역대책본부는
people.
해외
And the
입국자에게
KCDC
다음과 같은 주의사항을
urges
준수해 주실 것을
the following
당부드립니다.
guidelines for those who
유럽,
are
미국
coming
지역
from abroad. For those of you coming from Europe and the US, please take part in our screening measures. And please, upon your arrival, immediately please return to your respective homes. Please refrain from using public transportation and use your own vehicles. And starting from 28th of March, as we have reported earlier this morning, we will be providing transportation support, including the airport limousine as well as KTX, so that we can take you to to other regions. And when you are at home, please use your own sanitary equipment like cups and others. And also, if you don't have any symptoms, you still could be contagious because the virus could spread. So we advise you once again to keep our quarantine measures and keep our guidelines. And if you have any symptoms, before visiting the medical facility, please call our call center or report to us through your mobile application. If you violate the measures, you will be punishable by imprisonment up to 1 year or a fine up to 10 million Korean won. And for all of you who are returning from elsewhere, please refrain from going outdoors or going to work and stay at home for the next 14 days and minimize your people-to-people contact. If you have any symptoms, please call the KCDC call center at 1339 and visit a screening facility. And we also advise many of the employers, in order to curb the spread of the disease, we want to make sure that you ensure that employees returning from international business trips do not return to the office for the first 2 weeks upon their return. And as for the multi-use facilities, we also advise you to limit the entrance of those who have been traveling abroad. And the government also highlights you to minimize person-to-person contact, and we advise you to participate in our enhanced social distancing campaign. And we also have limited the use of multi-use facilities that are more prone to the virus. Thank you very much for participating in our enhanced social distancing campaign. This has helped us to maintain a stabilizing increase of the confirmed cases. However, we believe that we are still open to higher risks of infections. With the weekend just ahead of us, I know that it is very difficult for us to stay home, but we advise you to refrain from going to religious centers or indoor closed sports centers with crowded gatherings.
중앙방역대책본부는 코로나19의
The
장기화와
KCDC
사회적
expects
거리두기가
that
강화될수록
the
많은
prolonged
국민들께서 불안과 우울증,
outbreak
우울감을
would
느끼고
lead
있다는
to
점도
a
잘 알고
depression
있습니다.
on many
특히
people,
경제적인 피해가 큰
especially
자영업자,
for the
또 계약
self-employed
연기로
people
부담이 가중된
who
학생과
are having a
학부모들의
higher
심리적
financial
위축이
burden,
상대적으로
and the
크다고 보고
parents
있습니다.
who
이에 대한
are
따뜻한
having a
배려와
delay in
관심이
these
필요한
new school year. I
상황입니다.
believe these are the people who are going through much
신종
difficulties.
감염병 유행이
We need to send
지속되면서
them
누구나 우울감,
enhanced
불안감을
support.
느낄 수
I
있습니다.
know that
이러한
anyone
코로나
can feel
우울증을
a
예방 극복하기
depression
위해서는
under the
주변
outbreak of
이웃,
the coronavirus.
친구들과의
In order
연락을
to
유지하며
overcome
안부
this
인사를
depression,
나누고
it is very
서로
important for
격려하는
us to
사회적
send
거리두기는
warm
하지만
words
마음
of
가까이 두기
support and
활동을
comfort to each
권고
other
중입니다.
and ask
또한 전문가의 도움이 필요할
and call
경우에는
each other on a regular
국가트라우마
basis.
센터,
And if needed, you could also contact our KCDC call center or the National Trauma Center, which provides you specific and professional consultations. And the KCDC also, we would like to enhance our R&D measures, and we would like to cooperate with the Science Ministry and other related institutions to establish a team to form the R&Ds on the development of the vaccine as well as therapeutics. That's all for me. Thank you.
질의응답 가지도록 하겠습니다. 사전 질의받은 두 가지 내용에 대해서 먼저.
Right, that was the Central Disaster and Safety Countermeasure Headquarters with the latest facts and figures on the COVID-19 situation here in Korea. Korea has 91 new cases today, and that brings the total to 9,332. Of those cases, 13 were identified at the airport. Therefore, officials are calling on members of the public to limit their activities outdoors, as Korea is slated to witness a greater number of inbound traffic in the coming days, with people seeking to flee areas that have been hard hit by the virus. And in this next corner, we turn our attention to Europe, which has the highest death toll so far. The pandemic is no doubt reshaping the lives of people there. And for more on that, we have Rory Green, an economist in London, with us via Skype. Hello, Mr. Green. Perhaps we could start with your thoughts on how the virus is changing the community there.
There's been a huge impact on people's lives in the UK and across Europe. Now, most of the continent is close to full lockdown. So on Monday night in the UK, Boris Johnson moved the country into lockdown and banned all non-essential economic external activity outside the home. I'm talking to you now from my home office. So no offices are open. People are working at home, and they are in very strict quarantine measures now. And in many countries, this is not only enforced by the police, but also by the army. So in Spain and parts of France, the army is making sure that these quarantine measures are maintained strictly.
Mr. Green, social distancing has been recommended as one of the most important ways of preventing the spread of the virus. I personally believe we here in Korea have been quite determined to put this practice into action. What are your thoughts?
Yes, well, the Korean virus response as a whole has been hugely impressive. Very good response from the government, a lot of testing and very proactively tracking people down. The Korean public as well are doing an excellent job. Everyone is wearing masks and very strictly following social distancing protocols. And I think this has been one of the key aspects, as well as the government response, that has really helped to contain the virus in Korea. In the UK, it's not really the case. A lot of people were still going outside, not many people wearing masks at all. So the social distancing wasn't really respected here, which is a big problem.
Which is why the UK Prime Minister has yet again highlighted the importance of social distancing. If you were to compare the Korean public's response to social distancing with that of the British public, what else would you like to highlight?
Right, so as I mentioned, he was urging social distancing, and it wasn't really respected by the UK population. So last weekend was a very sunny weekend in London, and the parks were completely full of people outside, no masks, so it wasn't respected at all, and that led to him on Monday announcing more stricter measures to force people to stay inside and to really limit the amount of times they can go outside each day. So because the UK public didn't follow these social distancing measures, the government has had to go to a more sort of extreme, more draconian control to try and limit human interaction and the spread of the virus.
Mr. Green, there have been cases of racial abuse and those of people violating self-quarantine measures in Europe. How severe are these cases?
Yes, so certainly in the initial stages of the outbreak, there was a deal of racism and discrimination towards people of sort of Asian ethnicity. But actually now that the virus has spread everywhere and that almost anyone can be infected or can be a carrier, I think the racism is at least toned down or is not increased, because it can be anyone. There is not such a bias anymore. Where this might be a problem, a greater problem would be in the US, and the politicians there, particularly President Trump. He's describing the coronavirus as the Kung Fu flu, or the Wuhan virus, the Chinese virus. And this kind of rhetoric coming from the very top of the political establishment in the United States is filtering down to the public and increasing the racial tensions over in the United States. That's for certain. So hopefully this narrative from President Trump changes and we get an improvement there in the United States.
All right, Mr. Green, thank you for those words. Do stay safe, and let's hope the UK sees a drop in its number of cases in the near future. In this segment of our in-studio talk, we touch upon the drastic change in global social landscape in light of the COVID-19 pandemic. Venturing outdoors has been strongly discouraged across the world, keeping people, young and old, confined to their homes as part of efforts to contain the contagion. The gist is that social distance will allow for, if I may, social existence. For more on this, we have John Park, professor at Handong University, on my right. Welcome, Professor Park.
Thank you.
And Justin Fenders, professor at Tongseul University, on my left. Hello, Professor.
Thank you for having me.
Right. First, Professor Park, leaders of the G20 nations held their first virtual summit yesterday. What do you think?
Yeah, it's the first time that a virtual conference of this magnitude was held. And I think if anyone was lagging behind in the fourth industrial revolution era, I think we're all being thrust into it full on. But not just but the substance of the G20, of course, was to really bring about an agreement between the nations to really bring about a concerted effort together to tackle this worldwide pandemic.
Right. Professor Fenders, on the academic front, lessons have started for universities. They're online, I assume. Tell us a bit more about that.
Sure, yeah. So just about every university in Korea, as far as I'm aware, is essentially taking the lead of the government's recommendations for primary and secondary schools. So they're taking a look-and-see approach, and most of them, for 2-week segments, are saying either we're not going to have classes or we're going to put them online. So my university, for instance, we've put them online. It's a little unfortunate for the students because, you know, face-to-face learning is much better, but generally speaking, I think this is probably the best compromise you could have.
I see. Professor Park, I understand you're a former U.S. prosecutor.
Yes.
Speaking within your capacity as a former ranking official, how do you assess the current U.S. situation?
Well, we all know right now, as of today, I think U.S. is really the focus as the new epicenter. Major cities like New York City and in cities in California, of course, are gravely concerned, as well as even regional locations. I think with all eyes of the world really focusing their attention, life in the U.S. Really is unprecedented. Courts are, of course, suspended. Churches are closed. You have these cultural landmarks and other places that are just completely shut down. And I think it's a significant life changes that the Americans are going through. Even the tax deadline was pushed off to 3 months. And you have this, the government agreeing, I think, imminently with a $2.2 trillion relief aid package to handle the problem. So it's unprecedented, but this requires, I think, some type of unprecedented efforts to combat the virus.
That's true. Professor Fendos, could you walk us through perhaps the challenges that healthcare officials are facing in the U.S. in dealing with the crisis?
Right. So you could take your pick. I mean, there are a lot of them. So if I had to pick a top three, I would say the first is lack of testing. Second would be lack of consistent preventative measures. And then the third would be this issue of how is treatment going to be paid. So starting with the testing, I think that's pretty obvious. If you don't have enough, you're essentially flying blind and you really don't know who's got the virus and who doesn't, which is why you have to do very drastic things like lockdowns. Because if you had the testing, then you could take a more focused approach and keeping most of the population running, going to work, spending money, while trying to pull out the people who have infections in the virus. On the issue of preventative measures, I've been speaking to a lot of my colleagues, friends, and previous students in the U.S. last couple weeks, and I've actually been quite appalled by the lack of preventive measures in places like hospitals and these kinds of public environments. So in Korea, for instance, if you go to a hospital, you're immediately greeted by an army of volunteers who, test your temperature, they look to see if you're coughing, see if you have a mask on. You have to fill out questionnaires about where you've been, whether you've had symptoms. And if you seem to have symptoms that are similar to the virus, they take you aside, separate you from everybody else. And that's done to protect the rest of the population as well as the medical staff inside. But these kinds of basic things at many American medical centers, they're just not there yet. And to give you another example, for Korean hospitals, they have to have separate, when they can, they have to have separate pathways for medical personnel and patients. But even these kinds of very basic things, where you're trying to limit the crosstalk between patients and medical staff, you just don't see it in the United States, so that's a big problem. And then coming to the treatment, it seems like testing will be free. I'll have to see it before I believe it. But also for the treatment costs themselves, it looks like public insurance, so the government-based insurance, that will cover a lot of these treatment costs. But private insurers seem to be a lot less certain about how they want to do this. And I get the feeling that they're kind of stalling to see if the government will foot the bill for them. So they seem pretty determined to collect co-pays and things like this, which I think is very unfortunate, especially given the size of the problem that we have.
Right, I see. President Trump has asked Korea for testing kits.
Mm-hmm. Yeah,
and
not just President Trump, but I think maybe 40 other nations are calling President Moon. Obviously, when you have a country that is able to test its citizenry in the hundreds of thousands, and there are nations out there that are struggling to test even thousands or tens of thousands, I think people, world leaders, take notice of the ability of the Korean companies and the Korean government to be able to identify. Of course, that's the first line of addressing this problem, is to identify and diagnose the problem before they can start any treatment. And so I think these phone calls, of course, are important to try to get these kits to places that don't have them, particularly even in developing countries. And so I think that's a good sign of some efforts that Korean companies and Korean government can do to foster some aid, even though we're not really out of the pandemic either. But I think this is an opportunity to work together to help other countries.
I see. Professor Fendos, you earlier mentioned about the vulnerability that healthcare officials are exposed to. We take our attention now perhaps to the public then. Here in Korea, ensuring personal hygiene is very important. If you're out in the streets of Korea, virtually every single person on the street out there is wearing a mask. What are your thoughts about the Korean public's preventative measures?
So in any kind of containment effort, public cooperation is absolutely essential. I mean, the two main steps, testing and quarantine, have very strong voluntary components. So if the people aren't on board, probably nothing is going to happen. So in that sense, I've been very impressed with how compliant the Korean people have been. And I think there are a lot of cultural reasons why that might have been the case. So for instance, a lot of Korean culture is deeply rooted in Confucian ideals. And one of those is this top-down hierarchy of the society. And so I think that naturally makes Koreans a little more likely to follow instructions, which I think will help them a lot in this case. And there's also this collective mindset where people are willing to go out of their way to help each other and to protect each other. And I think that really is very important, especially when you're dealing with something dangerous like this epidemic.
And on that subject, of course, Professor Park, there is a different perception on the idea of wearing masks here in this part of the world and elsewhere around the world. Do you care to elaborate?
Yeah, I think there is. There's a cultural, I think, similarities and dissimilarities in approach to masks. I think that the average American would think of somebody wearing a mask in public as, what are you doing wearing a mask? You're obviously sick. You should probably stay home. You shouldn't be out in the public. And you know, people who wear masks are people who do surgery or nurses and hospital officials, not ordinary people. You shouldn't be out in public. So there is a little bit of that. I think in Korea and in Asia, because of the microdust issues we've had over the recent years, people are used to wearing this, wearing the mask. But also, I think many Koreans are wearing the mask out of consideration for other people, really, you know, because you can be asymptomatic but still be a carrier. And so do I want to give, maybe I am carrying this virus. And I think that kind of sensibility sort of permeates. So there definitely is some differences in the approach by the West. There is sort of this resistance to wearing a mask. But in this particular situation, I think you're going to see people getting on board.
I see. And it doesn't help that officials there are discouraging people from wearing masks, right, back in the U.S.?
Yeah, the whole mask thing is controversial. Some people say it's works, some people say it doesn't. But I think that we all know that any kind of touching, minimizing interaction with your hands, with your face, I think some of that, I think, does go a long way. And maybe even coughing if you're sick, I think. I'm a little bit more supportive, even though I don't prefer wearing masks myself.
Do you not wear a mask then?
No, in public places, I make it a point these days to try to do that, yes.
Professor Fenders, do you wear a mask?
Of course, absolutely.
Right, you do. Yeah. Professor, fortunately, hoarding, it's not a problem here in Korea. The coronavirus has not triggered chaotic consumption here, but this is not the case elsewhere. What do you suppose is the reason for the calm consumption here in Korea?
Right, so hoarding, panic buying, I think there are two things to think about when this happens. The first is from a psychological perspective, what does it mean? It means that people they're putting themselves first, essentially, right? And so they're a limited number of resources, and here I am, I'm going to take them, and I don't care if other people get them or not. And so that already says something about their mindset and perhaps even the culture. And I think another thing that comes into this has to do with faith in the government, because I think if you believe that your government is doing a good job and will handle everything the right way, I think you're much less likely to have this kind of panic buying behavior. And so when you look at some countries like the US, I think many of the people who do that perhaps lack that confidence in their government to really fix the problem. And so they're starting to rely on themselves in that regard.
Right, that's an interesting aspect. We had an expert here earlier on in the week who talked about this being about a crisis in confidence. Right. Professor Park, social distancing, as Rory Green earlier on, an economist from London, mentioned, it's quite well into practice here in Korea. Do you agree?
I do. I think Koreans are, as Professor Fenders also mentioned, sort of there is some, I think, criticism sometimes of Korea's hierarchical structure or maybe the groupthink mentality. But I think people are very concerned about this, as of course many other places. And Koreans are really thinking, all right, we need to, the time to or let down our guard is not now. Of course, the government is really encouraging that. 15 days, I think, until April 6th is when the public schools will start. We're all looking at that date. Each day we're evaluating. And really trying to comply and be a help and not be maybe spring breakers partying in the beaches and causing a situation like that. I think some good common sensibilities in the mentality, I think, does foster a good, healthy hygienic environment so that we can stop this virus right now.
Right, hopefully
Yes,
we'll keep
yes.
our fingers crossed. Professor Fenders, foreign media outlets have praised Korea's response to the COVID-19 pandemic. They've called our response democratic. Now, this, of course, was also a word that President Moon Jae-in used when he talked about our efforts to fight the crisis. What do you think about this?
Right. So actually, when I saw this word democratic, I wasn't quite sure what to make of it, but a couple things do come to mind. So the first is, again, this issue of public compliance, with the public actually being on board with the process. I think you could say that's democratic in a way. Another thing that's very democratic, I think, is the way that the Korean government has been using information and being extremely transparent about what's going on, what they're doing about it, and even providing people useful real-time information so they can make informed decisions about whether or not they were put at risk, whether they need to get tested, things like this. And I think those kinds of aspects, not only from a science and medical perspective are they important, but they also kind of give a sense of ownership to the people that makes them feel like they're really involved in the process. And psychologically, that's been shown to make them have a greater sense of responsibility for what they're doing. So I think there's that kind of double element to it, where not only is it the right way to do it, but it's also a good way to get people more involved by letting them know, hey, this is how you should do it.
Given the latest numbers right now regarding the virus, it seems that the war is not over. It will continue. I give this question to both of you. We could start with Professor Park first. What could be some other options that we could consider to ensure or to limit the pain of this pandemic, Professor?
I think we all can do our part. I think it starts with our families and in our communities. Really to have this sense of urgency and not to let down our guard, as I said. The time period to let down our guard may be months later. Right now is not the time. We need to be united in our effort. And so I'm really seeing good signs of course, Korean people, but people all over the world doing good deeds, trying to help someone. Even in my own school at Handong University, we've had the administrative faculty take a salary cut, 20%, just so that they can help. We've had alumni giving money to get more masks for international students. Small efforts like that, I think, go a long way, that we're all in this together, and let's figure out how to help the community and bless others.
Right, those acts of compassion, of course. What about you, Professor Fenders?
Yeah,
what other measures?
Yeah, so I also think that kind of cooperative and collective approach is, essential in something like this. And, this also extends to manufacturers, the private sector. I mean, a lot of Korean wine and beer manufacturers are producing large amounts of alcohol for use in medical facilities. That's also a really important part of the process. And also for the overall mentality of the country, because I found it interesting that you used the word war, which, Asian countries have been doing that. Western countries have been very hesitant to do this. But I think that's kind of an accurate depiction of what needs to be done, because there really needs to be a collective effort, everybody, pushing for a common goal of trying to beat this virus. And when you look at countries like the US, where, states are kind of doing their own thing, there's no collaborative, consistent application of rules, and there's confusion about how things should happen, you look at that situation, you can only shake your head and say, wow, they still have a ways to go. So I'm very worried about locations like that, where they still don't have that collective mentality of we're all in this together.
Professor Park, going back to your earlier response, actually, it's been said that character is forged during crisis. You spoke about taking a pay cut. We had landlords who agreed to reduce their rent.
Yes.
Do you suppose these acts of compassion are uniquely Korean?
I wouldn't say they're uniquely Korean. I think most people around the world would agree that I think the strength of a nation or strength of a person is tested during adversity. And so the signs of difficult times and challenges, we will look back, hopefully a few months down the line, a few years down the line, of how we were tested. But we, like the crucible, we came out stronger. And I really hope that certainly for Korea, but for all the nations in the world.
Would you agree, Professor
Yes,
Fenders?
I would. And actually, I'd add something that Professor Frank Snowden from Yale, he's a professor of medical history, he says that these kinds of pandemics and epidemics are like moments where you place a mirror to the face of a civilization, and you really get to see what they're made out of and what their fiber is. And I think what you've seen in the Korean mirror is very good. I mean, they've really come together with this collective effort. You've had thousands of people volunteer doing the things I mentioned earlier, like helping to screen people at hospitals or at department stores. You've also had thousands of ex-nurses come out to help do testing and things like this. But again, when you look at a lot of other countries, you don't see that sense of collective effort. And again, it's disappointing and it's unfortunate, because things are just going to take longer to fix if that's the case. And I think a lot of countries, they still haven't quite gotten the mentality that, even though I'm not sick, this is my problem too, and I also have to help. But I think Koreans were very quick in understanding that.
And hopefully it will spread out across the world.
I hope so.
Right, thank you very much for your time, Professor Park, Professor Fendos.
Thank you.
Well, that is all the time we have for now. We'll be back on Monday at this hour for the latest on COVID-19, so be sure to tune in. In the meantime, feel free to share with us your thoughts and inquiries through our social media accounts or our website, arirang.com. Thank you for watching.